to the local member for Benalla, Dr. Bill Sykes, who will be performing the official opening, but everyone else here, and we've also had a great number of apologies from people who contributed. But if you look around the room here and see just a small portion of the number of people who've contributed to get this service off the ground and into the medical centre, then I think it's really appropriate that we have this small token of appreciation so that, in a sense, everyone can see everyone else who has helped make this happen. So it's with great pleasure that I do welcome you here, and to introduce first of all Judy Dixon from the RMB, one of the very strong supporters, of course, of the service being here, the RMB, and I'll ask Judy to say a few words and also do the official thank yous. Thanks, Judy.
Thank you. I've got the lovely task. I'm getting to thank everybody, and it was just fantastic just to drive up and see open. What an achievement after all these years. Member for Parliament Bill Sykes, thanks for coming. Elise Sullivan, Senior Nursing Advisor, Rural and Regional Victoria. To Ron, our Chair of the Steering Committee. To Janine, CEO, Mansfield District Hospital. Distinguished guests and community, thank you for being here. I'm proud to be here at the opening of Mount Buller's year-round health service. It's been a long time coming, with the process kicking off apparently in 2003. I remember going to an inception meeting back then. We've faced many hurdles. We had the bushfires, we had the withdrawal of Symbion, but with the support of the Resort Management Board, the Department of Human Services, Monash School of Rural Health, and it's called
Monash University Department of Rural and Indigenous Health.
And the acronym is
MUDRIH.
There you go. Thank you. Mansfield Shire Council, our local doctors, Mount Buller Business and Community. It's finally become a reality. What a long process. So congratulations to everyone. It came around from a vision that we hold dear, that so many of us, everyone in this room hold dear, that we would have a year-round vibrant community with access to the services and facilities that are afforded to other remote communities. And that's been a massive challenge and a fantastic step forward just to recognise that fact. Unfortunately, there is no magic wand, and without persistence, tenacity and the dedication by a few hard-working and skilled people, it would never have become a reality. We all owe our thanks, and there are so many to thank, but the members of the Year-Round Health Service Steering Committee deserve special mention. So thank you in particular to Ron Edwards, our chairperson. Thank you very much. To Mark Woodsford, Carmine Mancuso, Joel Dixon, to Kathy Chivers as our Community Development Officer since November 2005. So she's really stuck in there and helped drive it. To the former members of this committee, to Dr. John Ferrier and Emma Shorland. Thanks also to the Health Reference Group members that preceded that group, being Dr. Phil Jolly, Janine Ridley, to senior council representatives at that time, and to Les Lambert from DHS. There are other people to thank, and I'll go through the list. And again, Chairman Rod Edwards is particularly keen to recognise these people because, it is a small community, and without that sort of effort, these things don't just happen. So, Monash MUDRIH, Philippa Green and Molly Burley for their support, planning, work on the submission, for their flexibility and their professional expertise, thank you. To the Resort Management Board, to Phil Nunn and his wonderful staff, to the Board for their financial support, in particular Tony Peterson for helping out us with negotiating, with organisational support, Jonathan Chivers for his technical support and patience, Linda Charles, who's moved on but was wonderful again with helping out organisationally, to Hayden, Mike and his team for help with vehicles and building management, to Mansfield Hospital, to Janine Ridley and Jenny Fawkes for their support in the planning stage, to Margaret Ann Hood and particularly Megan Hooper for setting up the service, to Les Lambert from DHS for his support throughout the whole process, to Angela Connors, Director of Health, Hume, and the Minister for Health. This is a pretty good one, for allocating $100,000 to fund the service for the first 2 years. To Dr. Bill Sykes MP for taking an interest in the project and for your support, thank you. Mount Buller CFA, Spoot Kelly for his ongoing drive, support and assistance. Mount Buller Ski Patrol, Sam McDougall and Speaky for their support and assistance. Foodworks Mount Buller to Carol, always in support and enthusiasm. To Mansfield Shire Council, and an acknowledgement to Mayor Sandy Jeffcott, who would have been here without previously scheduled opening, but he certainly has long shared the vision to have a medical service up here. Mount Buller Ratepayers Association, to Chris Wilson and to the Chair, John Eyre, President, who's here, thank you. The Lift Company, Laurie Blampede, Mansfield Medical Clinic, Dr Phil Jolly, Elton Edwards from the Alfred Hospital, to Mount Buller Education, Dr Richard Smith, thank you. Mount Buller Chalet Hotel, to Eric Seward, to the Chamber of Commerce on Mount Buller and Jaggard and Michelle Maurice in particular, to Rural Ambulance Victoria, the Mansfield branch, Rod Coulson, Rod Lenz and Brett Cooper, to Victoria Police, Kev, thanks for making the trip up, Mansfield Division 4 to Cameron McPherson, and lastly, but certainly not least, to the Mount Buller community for all of their support. Our year-round health service is funded by DHS via Mansfield District Hospital for 2 years at $50,000 a year. The Resort Management Board will provide a vehicle for the nurse, who's available, my understanding is Mondays and Thursdays, from the medical centre, and a wide range of services are available for a very affordable cost. Our year-round health service is a wonderful step forward for Mount Buller and its community. It's a critical stride, adding to our efforts over many years to fulfil our vision of Mount Buller as a year-round resort and great place to live, and not just a ski resort. Our connections with Mansfield are critical in achieving this, and the health service is evidence of the importance of this relationship. A special thanks also to DHS, who funded the health service in recognition that the Mount Buller community, even though it sits within a resort boundary and not a municipality, is entitled to key services. I congratulate everyone and thank you all for coming and for helping see this initiative become a reality.
Thanks, Judy. And I'd like now to call on Elise Sullivan, who I met this morning unknowingly, taking in our magnificent scenery, who's the Senior Nursing Advisor for Rural and Regional Victoria, to say a few words about the service here.
Thanks Ron, I really appreciate inviting me up today, and thanks Judy for that wonderful acknowledgement of all of the people that have been involved in developing this service. I must say that my preference is to come up here at this time of year, and it was beautiful walking around this morning, looking at the village and the hills, and just getting away from the city actually. So I really appreciate why you choose to be here and how important it is that you stay here. I'd like to also thank both Janine and Jenny Fawkes, who've I've worked very closely with over the last couple of years, and Megan Hooper on a project that we've been working on, which is about collaboration. I'll touch a bit on that in a minute. But one of the things that strikes me about this particular project is that it is truly collaborative, and this, certainly the work that I've been doing in health services in rural Victoria has been trying to create some sort of collaborative relationship between the department and health services. And I suppose our view in the department is that really the best services are those that are defined by the people that work in them and that are served by them. And this is really an exemplar of that achievement here, and I really do have to congratulate the people who've managed to do that over the last number of years, and also using the methodology that Molly Burley and Monash have developed over time. It's worked in a number of projects, and again it's worked here. And again, primarily based on the philosophy that you've got to engage the community to find what you do in services, and don't take away from them at all, enable them to very much be part of that service and build their capacity